Okay, so I know that you might have been, doing so many listening tests before, and I just want to add on maybe few things, or maybe you might be doing the same way as I'm telling you, but we definitely have to look after why things were not going well. I hope I'm audible to you. Can you hear me, Dr. Riaz?
Yes, sir, I hear you, sir.
Okay. Now, so this is your part A. See, whenever you are given the test, the listening, see, listening is very important, and it takes a lot of focus. You have to be very, very focused while you're doing listening. Okay. So whenever they are giving you, you know how to do it, right? So I'm not going to go much in details. So you know you have 30 seconds to read the 12 questions. Okay, from that, like this is extract one, and it has 12 questions in total, and you will have 30 seconds to read it, right? After 30 seconds, after 30 seconds, they will start the audio and you have to put your answers over there. Now, the thing is that how would you know what is the answer, okay, and where is the answer? That is very important. And that's what we are going to do. Okay. So now, how are we going to write the answers? The first and foremost thing is, as I always mention, that you have to use the pencil. And what I mean by using the pencil is that you have to underline the stuff before and after. For example, if you see, it is a conversation. A physiotherapist is talking to a new patient called Ray Sands. Now, always remember that the patient will be giving you the answers that are going to be fulfilled in this here, okay, this empty box. So you have to follow the lines of the patients, not the doctors. This is important. So now you know where to focus. You have to focus on the patient's words. For example, doctor is telling that, have you done this? You do, even if you were not focused on that particular time, it's fine. But when the ray ends, the patient will speak. You have to listen to those words very carefully in order to get the answers right. Now that's the important thing. Okay, so you don't need to be alert all the time, but you have to be alert when the patient is speaking something. That's the main thing. The other thing is, in those 30 seconds you have to underline, and you have to practice in a way that you have to practice. I'm sorry, while you're practicing that, you have to develop this habit of making assumptions or predictions. For example, it is written over here, 18 months ago, back injury sustained. Okay. So the patient had some sort of back injury. For what reason? Maybe, and it is given in the bracket that he was lifting something. Okay, so he was lifting something. Now you have to understand what was that something he was lifting. Okay, so what do you think? If you have done this test, you might say something which is exactly accurate. But if you have not done it, there are few things that comes in your mind. It could be, he could be lifting a box, he could be lifting a chair, he could be lifting a table, he could be lifting, you know, a bed, a sofa, something which is heavy that can cause back injury. So this is your prediction. So while reading, you have to think that way. and you have to practice in a way that these sort of words will come into your mind. Now, here they are asking pain located in. Now you have to think that if they are talking about location, and you also have to use the common sense as well, that they are talking about the back. Over there is a back injury. Now, if you are a doctor and you have to use common sense, so pain located in, it could be in back, it could be in hips, it could be in legs, it could be in thighs. Okay, it could be somewhere nearby the back area. Okay, he described the pain. He has described as intense pain, severe pain, worst pain. This is the description, a simple word description that the patient can give you. Okay, if someone comes in your clinic and asks you, doctor, I'm having pain, you will say, where is the pain? This is the location. Okay, then he will you're asking, can you describe the pain for me? Is it dull? Is it sharp? It is agony? Is it tense, intense? It is severe? So this is how the description comes in. Okay, so the patient might be describing something about the pain. He might be saying it's very bad, intense. For example, when we say that there is a subarachnoid hemorrhage, so the worst headache of life, okay, or thunderclap headache. So he might say pain described as thunderclap headache. So this is the description of the pain, and you have to be very active while listening to these words. They might use synonyms. Okay, then the patient is mentioning that he's unable to do something, inability. Okay, this inability, what sort of inability he is talking about, that will come over here, that he is unable to do something. Okay, he is unable to do something, inability to dash, and that is the most frustrating aspect. Okay, he's telling you that, doctor, I can't walk. He might mentions inability to walk, and that is the most frustrating aspect. The other thing that they can trick you in these sort of senses is they might give you 3 4 things. Doctor, I'm unable to sleep, and I am unable to walk, I'm unable to talk, but the most difficult thing for me is to sleep. So you have to be very careful while listening to these words, that what they are suggesting, the most crucial thing would be, for example, out of 5, what is the most frustrating for the patient? That's the main thing. Okay, then comes there is sensation in the calves. How many sensation do you think are there with the pain, Dr. Riaz? Can you give me some sensations, the words that is suitable with the sensation?
टेंशन है ना
Sorry?
जी सर
Yeah. Can you tell me what sort of sensations are there? Like in
pins या radial sensation या pin sensation sir something like that sir
yeah, so they can say that sensation like burning sensation, pins or needling
yes
sensation, numbing sensation. So these
yes
are
yes
any sort of sensations. So you might don't know before, but if you have these things in your mind, if you are developing the skill while practicing, you will understand while they will tell this sort of word, a very quick answer will come into your mind. So, for example, sometime you might miss an answer. Okay, during the audio, you might have not picked up the right answer very exactly. But if you have this sort of prediction in your mind, then it is possible that you might get the right answer. Okay, so now this is all about the Now I'm playing the audio. Okay, so I want you to listen to it, and let's just try to answer it. Okay, and then I will answer it again. Okay.
You'll hear a number of different extracts. At the start of each extract, you'll hear this sound. 2 different extracts. In each extract, a health professional is Extract 1, questions 1 to 12. Notes.
Come in. It's Mr. Sands, isn't it?
That's right, Ray Sands.
Now, I think you've been...
Can you hear the voice, please?
Yes, sir, I hear. No problem.
Come in. It's Mr. Sands, isn't it?
That's right, Ray Sands.
Now, I think you've been referred to me because you're suffering from sciatica.
That's right. Not for the first time, actually.
OK, well, I've got some notes here, but perhaps you can tell me in your own words about any previous bouts of sciatica you've had, what treatment you had, what worked for you, anything else you can remember.
Righto. Well, it all started when I hurt my back. About 18 months ago now.
OK.
I was giving somebody a hand with a heavy suitcase and I felt it go, you know, woof, just like that. Anyway, I slowly got over that, despite occasional flare-ups, and then, out the blue, about a year ago, sciatica developed. And it was 6 months till that finally cleared up altogether. Now it's come back in the last month or so, I'd say.
I see. And your GP said it was sciatica?
Yeah, I had this pain all the way down my right leg, and she said the real problem was in my back, because the sciatic nerve was getting trapped.
Right.
I mean, I'm telling you, this was no ordinary pain. It was really intense. I mean, to the extent that I couldn't stand for very long, couldn't walk hardly any distance, I couldn't sleep.
Oh.
I mean, the most frustrating bit for me was that I couldn't even turn over in bed. It just hurt so much. I just couldn't get comfortable. Do you know what I mean? Sometimes I'd have, a sort of tingling feeling in my calves as well.
Right.
But then at other times, my whole leg just felt a bit numb, really. It was weird. And of course, I couldn't go to work.
Okay, so you have heard all the answers. What do you think is the right answer for the question?
Sir, heavy suitcase.
And what the other one?
Ji, sir?
For the next
Heavy
one,
suit- Sir, next one, pen located in the bag, sir.
located in the back?
Ji, sir.
No. He said the pain was in the right leg, but the doctor mentioned that the problem was in the back.
In the bag. Yeah.
Did you hear that?
Yes, sir.
Now, this is what I'm saying. You have to be very, very focused. If your focus is out for a nanosecond, everything is gone. Okay?
Okay, sir.
It was no ordinary pain. It was really intense. I mean, to the extent that I couldn't stand for very long, couldn't walk hardly any distance, I couldn't sleep.
Oh.
I mean, the most frustrating walk hardly. It was no ordinary pain. It was really intense. I mean, to the
And your GP said it was sciatica?
Yeah, I had this pain all the way down my right leg, and she said the real problem was in my back, because the sciatic nerve was getting trapped.
Right.
Yes, sir, I got it now, sir.
Okay. So the
Ji, sir, right
pain
leg,
was
sir.
in right leg.
Right leg, sir.
Okay. Then the pain was
Intense.
described as
Intense, sir.
Okay. Then the mentions in ability to do as prescribed.
Turn over the bed, sir. Turn over.
Turn over the bed. And this one is
tingling sensation, sir.
Tingling sensation. Okay, so that's how. See, in between, you just have lost your focus in one thing for maybe for a
Yes.
second or something, and your answer was wrong. Okay,
Yes. Okay, sir.
so you cannot lose your focus while doing listening part A. And I have to be very, very honest about it. If you're getting any less than 24 out of 24 in listening, you're already lacking behind.
Yes.
See, 24, if you get 24 in the listening, okay, then you just need 6 more out of 18 questions from part B and part C. Okay, and listening part A is very easy. It's just about focus, as I mentioned. Okay, so same goes with the listening part, reading part A as well. You have to get 20 out of 20 from reading and 24 out of 24 in the listening. If you if you think you can't get it, unfortunately this will keep on hurting you. So your strategy should be to get everything right in the part A of both listening and reading. Okay,
Yes, sir.
so just focus on this. Now let me tell you a few seasons that you can watch in order to
Yes, sir.
improve your listening. Okay,
Yes, sir.